your experience having obviously transitioned through a huge technological advancement in today's society, and also doing research in obviously the UK and Canada as well. What's been your experience seeing orthopedics transition through its evolution of technology?
It's huge. It's happening all around us. You know, my kids grew up with the internet. I barely knew what the internet was when I was growing up. And so there are technological opportunities that can be applied to medicine. Orthopaedics is one of those areas where things like robotics, things like artificial intelligence can be applied to get the best outcome for patients. Often we take a pre-existing technology, determine if there's a value in the advancement of the new technology, and then apply it. My PhD actually involved the assessment of patient-reported outcome measures using an electronic database. Prior to when I started practice, people were collecting that type of information using paper forms. That's obviously very time-consuming, very expensive. It takes a lot of resources and a whole team behind you in order to achieve it. The advent of technologies such as that, where we can essentially send someone out a questionnaire pre-operatively, and then at specific time points post-operatively to track their progress or track their recovery following a certain procedure, is integral to our understanding and our assessment of the validity of a procedure, and also the outcome of that procedure, both for individual patients and the collective of patients undergoing that procedure. Things like robotics take a pre-existing technology and improve it if there's a application that can be augmented to improve that type of thing. For example, my ability to hold my finger in one position is limited by fatigue, and it's limited by several other factors. A robot we can hold in space for an indeterminate length of time, and we can very painstakingly improve the position relative to space of that particular instrument, so that we can get a precise location for a particular subset of the procedure, so that we can minimize the risk of having problems or getting things inaccurate. And so the ability to use those technologies to improve our own surgical expertise from a technical perspective is really quite exciting. There are a few applications that I use on my iPhone, for example. So some of our research has looked into range of motion assessment remotely. So say, for example, our patients in the country that can't necessarily come in for every follow-up appointment, they can take, using one of these applications, a picture or a video on their iPhone, and then send that to our research group or our nursing staff, so that we can at least have a general idea of the range of motion at specific time points. There are applications that will measure the range of motion, for example, and then compare it to other time points, so that we can see patterns over time, see if someone's stagnated in terms of their rehab, so that we can then intervene or make changes to their rehabilitation, so that we can optimize their overall outcome. So simple things like that that are widely available and always being innovated are really important to keep on top of from a surgical perspective, so that we can get the best outcome for our patients overall.
Well, that's fantastic, James. And look, it's interesting to see that you have such a patient-centered approach, and I think that's really admirable, because in that stage of pre-surgery, during the surgery with the robot, and also post-surgery, in that communication aspect is really fantastic.